BMI, or body mass index, is often used by health professionals because it's easy to calculate, it requires no specialist equipment, and it's a reasonable guide with respect to health risks. The higher your BMI, the greater the risk is to your health. However, BMI is not a perfect instrument. The current definition of obesity is based on historical records which don't consider key individual factors such as a person's genetics, their biology, ethnicity, bone density, or their muscle mass. For example, whilst we know that Caucasian populations have a significantly higher risk of developing conditions such as type 2 diabetes at a BMI of 30 kilograms per meter squared, the same increased risk actually occurs at much lower BMIs for people of South Asian or Middle Eastern origin. In addition, BMI doesn't consider a person's pattern of fat distribution. There is extensive research which suggests that people who carry most of their weight above their waist and around their internal organs, often described as an apple shape, have a much greater risk of developing conditions such as heart disease and diabetes compared to people who carry their weight below their waist, around their bottoms and legs, often described as pear-shaped. More recently, there has been a move to use other simple approaches to measure health risk. One alternative includes the waist to height ratio, which may be a more useful tool in people with a BMI of less than 35 kilograms per meter squared. So whilst BMI is an important guide, it is by no means perfect, and other factors should be considered when assessing obesity and risks to health.